Hello viewers, welcome to Smartness tutorial. Today we want to dive into one of the important aspects of Nursing and Midwifery License exam topics, which is electrical imbalance. We are going to do the discussion of electrical imbalance using past questions from NMC. So that means that we are going to review those questions on electrolyte imbalance. And so it is not just going to be the normal answer given, it is A, it is B, it is C, or hyperkalemia or hypokalemia. But Smartness tutorial is going to help to analyze the possible answers and choose the correct answer for you, and that will help you to be able to answer any question relating to electrolyte imbalance in case you meet any question on that concept. And so if you are watching me from TikTok, please make sure you watch the full video, because the full video cannot be loaded onto TikTok, but get onto my YouTube and watch the full video. Okay, so let's get started. The first question is: the movement of electrolytes between cellular compartments is A. requires hydrostatic forces, B. is regulated by osmotic forces, and C. requires ATP for the transport. Put your answer in the comment section. I believe you are done. Alright, so now let's look at the correct answer here. The correct answer is C. Why is it not A, and why is it not B? The A and B, hydrostatic forces and osmotic forces, helps in movement of fluid, water, and not electrolytes. Okay, so the answer now becomes what? Active transport. And you know, with transport we have the passive transport and we have the active transport, but this one, it is what? Active transport. So normally substances move across cell membrane with a concentration gradient. With what? A concentration gradient. That means it is moving from a higher concentration to a lower concentration. But when it comes to electrolytes, they move against concentration gradient. That means it is moving from a lower concentration to a higher concentration. And from a lower concentration to higher concentration, there's a certain energy that is needed, which is in the form of what? ATP. And that is why the answer here is C. Okay? Alright, now let's move on to the next question. Question 2. The most important electrolyte in the extracellular fluid is A. potassium, B. sodium, C. calcium, and D. chloride. What is your answer? This one, within a second you should be able to answer it. Put it in the comment section and explain why. So the correct answer here is B. So with the fluid compartment, there's intracellular and there's what? Extracellular. Okay, so the intracellular, the main electrolyte there is what? Potassium, and that means the A to be incorrect. But when it comes to the extracellular, the main electrolyte there is what? Sodium. Okay, chloride is an anion which is found mainly at the extracellular fluid compartment. Okay, so now let's move on to the third question. So the third question says that which of the following describes the distribution of sodium and potassium between cells and body fluids? A. potassium mainly in the cells and sodium in the body fluids. And then B. sodium mainly in the cells and potassium in the body fluids. And then C. equals amounts of each ions in the cells and body fluids. D. little of either in the cells but large amounts of each in the body fluids. I just explained this for you. Okay. Okay, so this is so should be so simple for you to write your answer in the comment section within a second. All right, okay, so now let's look at the correct answer here. The correct answer here is what? A. Okay, so they just want to trick you here. They say potassium mainly in the cell, which is correct. Okay, potassium is the main intracellular electrolyte. Then sodium in the body fluids. The body fluids are mainly found at the extracellular, where we have the transcellular fluids, we have the interstitial fluids, and then we have the intravascular fluid, which is what? The blood. Okay, so sodium is really found outside the cell, which is what? Within the body fluids. Okay, and not the B, which is interchange of it. They have changed it. Now let's look at the fourth question. Are you ready? All right. So question 4. A client's kidneys are retaining increased amounts of sodium. The nurse plans care, anticipating that the kidneys are also retaining greater amounts of which substances? A. Calcium and chloride. B. Chloride and bicarbonate. C. Potassium and phosphate. And then D. Aluminium and magnesium. So what is your answer here? Yes, waiting for you. Answer in the comment section with the explanation. Alright, so let's look at the correct answer here. The correct answer here is B. So as for D, it is a no because the kidney has nothing to do with the aluminium and what? The magnesium. Okay, so in terms of the regulation, but potassium, there is something that the kidney plays a role with. But the question here is, let's go back to the stem again. They say what? A client's kidney are retaining increased amounts of sodium. So the kidney is reserving sodium, and which other electrolyte will also be retained or reserved, and which is not potassium, because that is the direct opposite. When kidney is retaining sodium, they are excreting potassium, and so the C is out. Okay, then let's look at the B. The B says chloride and bicarbonate, which is the correct answer, because anytime sodium is being retained from the nephron, especially the loop, the kidney also retain what? Chloride. So they move hand in hand. And then sometimes bicarbonate is also retained when sodium is also what? Retained before in situations whereby there's what? Acidosis. Okay, so sodium is retained, bicarbonate is also retained in order to correct the acidic nature of the fluid. Okay, all right, I think this explanation has helped you so much. Now let's look at the fifth question. Question 5. Potassium excess can result in A. Tongue fissure, B. Muscle cramps, C. Sunken eyes, and D. Increased sweating. La la. Okay, so I believe you have written your answer down. Now let's check and see the correct answer here. The correct answer here is B. Correct answer here is B. Now let's look at the question again. Say potassium excess can result in. So the question is just asking for the clinical features of hyperkalemia. Okay, so hyperkalemia. Now let's understand something about potassium. Okay, potassium is one of the electrolytes that helps to stabilize the cells. Okay, the electrical stability of the cells. That means that it helps in muscle contraction, it helps in nerve impulses. Okay, so now there's also something we need to understand about electrolyte imbalance. Okay, this is a fact I'm going to give you that will help you to answer the remaining questions. Anytime there is high amount of a certain electrolyte in the cells, there is a low excitability. But when there is a low amount of that electrolyte in the cells, the muscles become highly what? Excitability. And so here we are talking about potassium excess, so we expect the muscles to have what? Low excitability. And so for potassium, that is hypokalemia, it will lead to muscle cramps, tingling, numbness, muscle weakness, and what? Arrhythmia. Okay, and so that is why the answer is what? Muscle cramps. As for tongue fissure, it has to do with what? A vitamin deficiency. Sucking eyes, as you know, is what? Dehydration, and then increased sweating can be as a result of increased metabolism or excessive exercise. Okay, so the answer there is what? Muscle cramps. Now let's look at the next question. A 15-year-old nephrotic syndrome patient is on furosemide. Which of the following electrolytes will be depleted in this patient? A. Phosphate, B. Calcium, C. Potassium, D. Magnesium. Waiting for your answer in the comment section and the explanation. Time is up. The correct answer is what? C. Let's look at the question. Let's look at the stem of the question. And the key term here is a patient is on lysis furosemide. What electrolyte is expected to be excreted or depleted or go low because of the lysis? So we know that lysis is a diuretic. And with the diuretics we have thiazide, loop diuretics, and potassium sparing diuretics. And so furosemide is an example of loop diuretics. And what loop diuretics, especially the furosemide, does is that they waste potassium. Okay, they what? Waste potassium. So when you take lysis, potassium will be deleted, and that means that when a patient is on furosemide, the nurse or the clinician needs to monitor for hypokalemia. Okay, hypokalemia. Okay, all right. Now let's look at the next question. Question number 7. Mr. Kosivi Abam, aged 45, reported to your unit with complaints of muscular weakness, constipation, anorexia, and on assessment revealed bradycardia and heart block. Which of the following condition is the patient suffering from? A. Hypercalcemia, B. Hypercalemia, C. Hypocalcemia, and D. Hypokalemia. Your answer and your rationale in the comment section. This should be so simple for because I'm giving you a clue. Okay, all right. Time is the correct answer here is what? A. I know and I believe you are shocked with my answer because myself I have seen books containing MCQs and answers choosing hyperkalemia, and personally review this question with some group of students, and I also chose hyperkalemia. But today I'm using a different lens analyzing this. Let me do it for you to see. Now, I said that anytime a certain electrolyte, for example potassium, calcium, is high in the muscles or in the cells or the blood, the patient is expected to the muscles are supposed to have what? Low excitability. So high potassium or high calcium will lead to a low excitability, and then low potassium or calcium will lead to high excitability of the muscles or the cells. Now let's look at the complaints of the patients. Muscular weakness, constipation, anorexia, bradycardia, heart block all shows that the muscles are not excited. So that means that there is a certain element that is what? High. So that means the C and D are incorrect. Now, why did I choose hypercalcemia? Yes, when we talk about bradycardia, heart block, muscle weakness, all can be found in hyperkalemia. But one thing we need to understand is that one of the hallmark of hypercalcemia has to do with constipation. That is why when patients with hypertension take nifedipine, they are also at risk of this thing. Okay, so it is hypercalcemia. Okay, all right. Then now let's look at the next question. Question 8. A nurse is assisting in the care of a client with pheochromocytoma who has been experiencing clinical manifestations of hypermagnesmia. When evaluating the client, the nurse should determine that the client's status is returning to normal if which no longer is exhibited. A. Tetany, B. Tremors, A. Reflexia, and then D. Muscular excitability. I know this one is so simple, and I know you have put the correct answer there because using the previous explanation, this will be so simple for you. If you chose C, you are correct because the question is asking for symptoms of hypermagnesemia. And so hypermagnesemia, we expect low excitability of the muscles. When you look at tetany, tetany is about muscle spasm, which is hypomagnesemia. Tremors is also about excitability of the muscle twitching, okay, which also will go for hypo. And then D is also so muscular excitability, okay, which all will go for hypo of a certain electrolyte. But here we are looking at for hypermagnesemia. So the A reflexia means absence of reflexes, okay, because there's low excitability, right? Okay. Question 9. A patient reported to a health facility with the complaint of diarrhea. Muscle spasm is something ringing in your ear, laryngeal spasm. Under assessment, patient was observed to have positive Chvostek sign. What other cardinal sign would the patient exhibit? So we have muscle spasm there, laryngeal spasm there. We expect something to be what? Hypo, because there's high excitability. Alright, so put your answer in the comment section with the explanation. Alright, so the correct answer here is B, hypocalcemia. And you understand that the C and the A are out. So now we think about the B and the D. But when you look at the stem of the question, there's a certain cardinal sign, positive Chvostek sign. Positive Chvostek signs and Trousseau signs are cardinal signs of what? Hypocalcemia. So the answer is what? B. Now, we are going to apply what we just did in question 9 here. So we say Nana Kodria's lab test revealed that his serum calcium is 2.5 milli equivalent per liter. Which assessment data does the nurse document when a client diagnosed with hypocalcemia develops a carpopedal spasm? So you see the spasm in hypocalcemia after the blood pressure curve is what? Inflated. So the calcium level is okay. So the possible answers here: positive Chvostek signs, positive Trousseau signs, and C, tetany. What is your answer? Okay, this was simple, right? Alright. So check your answer, and the correct answer here is what? The Trousseau sign. Okay, so let's go back to the stem. Serum calcium level is 2.5, and you know the normal calcium level is 8.5 to 10.5, and so 2.5 means there's what? Hypocalcemia, which has also been stated here for you. And I said the main or the cardinal sign of hypocalcemia is positive Chvostek signs and the positive Trousseau sign. Now they are asking you when blood pressure curve was inflated beyond the systolic. So the patient's the BP apparatus, the curve was applied at the arm here, and they inflated beyond the systolic. And then we saw a carpal pedal spasm. Okay, this carpal pedal spasm is talking about the wrist flexing, the thumb abducting, and then the fingers extending. Okay, so when this happens in a patient with hypocalcemia, it means this person is suffering from what? Trousseau's sign. Because Chvostek signs, remember Chvostek sign is about what? The cheek. Okay, C for cheek. So you tap the cheek and you see twitching of the facial muscles, and that is a positive Chvostek sign. But Trousseau signs, Trousseau is equal to tourniquet. So the blood pressure curve acts as what? A tourniquet to provoke spasm, and that is what Trousseau's sign. Okay, all right. And among these two, the main one that helps to determine early sign of hypocalcemia is positive Trousseau's sign. Okay, all right. Now let's look at the last question, which is question 11. Which patient below would have a potassium level of 5.5? A patient, a 76-year-old who reports taking Lasix, which is furosemide 4 times a day. Then a patient with Addison's disease. Then C, a 55-year-old woman who have been vomiting for 3 days consistently. And then a patient with liver failure. The last answer in the comment section with explanation. What did you choose? Oh, check. Are you correct? The correct answer here is B. Okay, so we know the A is out because when you are taking Lasix, you are wasting potassium. But the question here is says which patient below will have potassium level of what? 5.5. We know the normal value is what? 3.5 to 5.0. And so 5.5 means there's what? Hyperkalemia, high potassium. So definitely if you are taking Lasix, you are rather going to have what? Hypokalemia. And C is what? A woman who is vomiting. Vomiting, when we are vomiting, we are bringing out what? Potassium. So we should monitor you for what? Hypokalemia. And then D, a patient with liver failure. Liver failure can lead to either hypokalemia or hyperkalemia, depending on the etiology and depending on the region of the liver or the damage or the mechanism of it, okay, which I will explain in another video. So why Addison's disease? Now we know Addison's disease is a type of endocrine disease that occurs when the adrenal gland is not able to produce enough aldosterone. Okay, and what aldosterone does in the nephron is that it helps to conserve sodium. Okay, and so since we don't have enough aldosterone to conserve sodium, the sodium level in the system will go low. And remember, anytime sodium goes low, what? Potassium also goes high, and that is why this patient can have what? A potassium level of what? 5.5 and beyond. That is what? Hypokalemia. Okay, so thank you so much for staying with Smartness Tutorial to review this interesting, exciting, and challenging questions. Okay, like the video, comment in the comment section, share the video to your colleagues because they also need it. Don't be sad because you all need to pass your NMC exam. Bye bye. Meet you